because of them being in the lower grades, they aren't eligible for vaccines yet. But regardless, you may have holdouts and people who say, I'm never going to get vaccinated, students who say they're never going to, and parents who will not consent. Testing gives you a channel of protection, and you establish that. And if something happens where you need it, you dial it up, or with very low positivity, we can keep it at a basic level, but we have made it available for you. We have 2 programs, Shield and Binex Now. These are our state programs for testing that we put into place. Doesn't mean there aren't other testing options out there, but these are what we've made available to you. First is the Binex, which I'll go over in a minute, and I'll show you on my next slide. But we have updated guidance that also has incentivized testing, and there's some advantages to you doing and instilling a testing program. There are some advantages of that, and I'm going to show you that. We're going to discuss that in a minute. You can go to the next slide, John. 2 programs. These are our IDPH sponsored. Binex Now, 15-minute rapid antigen, free to schools administer. We heard that you also had some administrative burden, and so we created a turnkey solution where schools don't have to administer it. Shield saliva testing, least invasive, yet highest sensitivity, with it being a nucleic acid amplification test. It's run in a laboratory. It's a polymerase chain reaction test. These are all, it's very high sensitivity. That's the takeaway there. Fast results and free to most of the schools, which fall into a tier 1 and 2, and then 3 and 4 heavily subsidized. This is a turnkey solution. And next slide, John. So this didn't come out as clear, but even though the words are small, the message is big. Here's the key. We need you as stakeholders to be ready. Have a program, put it in place. How are you ready? You put that program in place so that you have it there. And then it doesn't matter if it's there and one uses it. So your voice as leaders is strong. We need you to strongly encourage, make it available for your students and their parents to opt in. And for those who are unvaccinated, have that there and available. Have a testing program available so that and help students make the strong choice and positive choice to test if you're not vaccinated so that you can maintain in-person learning. I don't want to see disruptions in the future because I need my kids to be in school. And I know you all want them to be in school too. So with that, we're going to go a little deeper. We're going to hear some more from, as John mentioned, some key leaders. And the first to kick it off is going to be Judy Karaf. She's one of our lead epidemiologists here at the Illinois Department of Public Health. And Judy has been leading the way in terms of our epidemiological response and how we get our operations to line up with the science. So with that, I'll pass it to Judy. Thank you.
Thanks, Charles. Well, good morning, everyone. Judy Karaf, Section Chief here at IDPH and Communicable Diseases. And as Charles said, schools have been one of my main focuses throughout the COVID pandemic, as well as ongoing surveillance and essentially all major settings where COVID has persisted. So hopefully you've all had a chance to read the updated guidance that came out last week. And the testing guidance was updated on a couple of other things. It's actually a document we've been working on for a while just to clarify some new guidance for antigen testing and NAT testing. But we also added in a new option for those that are doing screening testing that allows them to use a modified definition of a close contact. So when you have a student and exposure in the school, if you are testing weekly, either according to the IDPH testing program or a program that meets the qualifications of your local health department, then you're only required to quarantine those students that are less than 3 feet for a cumulative of 15 minutes in a 24-hour period. So the definition of a close contact will remain the same. with the change that it's only those less than 3 feet. It's something you all have been asking for a very long time. I'll get into the weeds of that a bit more in the next slide. And then also that guidance was updated about outbreak testing. One of the more challenging things us public health folks have found when we were working with schools is a lack of testing in response to an outbreak. I've been pretty involved in several outbreaks. The one that comes to mind was a pretty large, unsanctioned, something I would never have recommended, prom, where there was lots of close contacts on parts of that prom that weren't sanctioned by the school, but were a parent thing, including a 2-hour bus ride. And so right off the bat, my recommendation would be to test everyone that was exposed. When you have that level of exposure, you have transmission that extends beyond the school and it extends in the community and can continue to let this virus simmer and explode in communities. And in fact, that community did see and had been in an area of heightened or increasing transmission. And so one of the things that we're going to start and make more of a requirement going forward, and it's very similar to what we do with pertussis and mumps, is looking at that unvaccinated population and making sure when there's an outbreak that all students are being tested and that they test at a cadence that's the same thing we do in a long-term care, same thing we do in a home shelter, that we continue to test for a period of at least 2 incubation periods from the last positive case. So I introduced it in this guidance. You'll see it more in the updated guidance, more of a mandate really than a recommendation at that point, but we want to get schools ready to be thinking about being ready to test should they have an outbreak. And so that's thinking about parental consent, the logistics of testing. And as Beth will explain a little bit later, Shield Illinois is a ready to implement tool for you, and we can marshal that in pretty quickly, providing you've already did the work to have parental consent available. And again, we're only talking about unvaccinated staff and students in this setting as well. Next slide. So we test in schools, I think I've summarized some of this in a little bit, but really testing has priorities. So we would want all schools to have the ability to test for anyone that develops symptoms regardless of vaccination status. And you all, I think, have lived this and learned this. If you can test that student right away, and we're hoping we've got the message out that unless you're in an outbreak situation or this is a known close context, Binex now is okay. Test that student and send them back to school as long as they don't have a fever or something that requires them to be home for a 24-hour period or such, or be afebrile for that. So at a minimum, we want to see you testing, can you go back, John? Testing for symptomatic students. And that is going to continue, even I'm working on changes for the fall, and we're going to continue to require swift identification and testing of any students with COVID-like symptoms. And then when identified as close contacts, those unvaccinated students need to be tested. This is standard operating procedure for us now. Again, it's been a challenge in schools because the parents have learned that if I test my student and they're positive, then a whole lot of cyclical things are going to happen, or kashinding with their friends, and somewhat of it can be stigmatized for that student. And my counter to that is then get your child vaccinated and they don't need to ever be quarantined. And then those that are the outbreak, as I just mentioned, and then in the screening testing. As Charles said, screening is extremely effective in lowering transmission within a school by identifying your positives as soon as possible and removing them from the school environment and lowering transmission risk there. And again, when screening, we're only talking about testing those unvaccinated students and staff. Next slide. So just a little bit more detail into that modified quarantine. Only schools that are using either the IDPH testing program or another screening program. Many schools, a couple of them on this call today, have been doing a fantastic job of testing for the whole year, have perfected that, and we want to reward their behaviors as well. So those two categories are eligible for using this modified quarantine. Right now, we're talking only about classrooms. We want to, when you assess the exposure situation with your school nurse and your health department, make sure there were no breaches in masking, and so there wasn't a time where masks came off, or students were in less than 3 feet social distancing for like a science experiment. And only those students who are opting into the testing program get to get the modified quarantine. And again, it's those that are less than 3 feet for cumulative in a 24-hour period. Over, next slide. And then for the testing recommendations, so if you look at the CDC testing recommendations, which is what we ask you to follow, if you're in low and moderate transmission, and I'll show you next slide what that looks like right now statewide, but in either category, we'll have you test all unvaccinated staff at least weekly, and all athletes, and actually we extend this to all extracurricular at least weekly. That's where we're seeing our outbreaks, that's where we're seeing transmission, and even it may not even be about the sports play, but it's about the socialization that happens around that, the congregation, the carpooling, the hanging out after practice, where we see the transmission. So those are high-risk students, and we want them tested weekly. If you're in low, then the entire student body doesn't need to be tested at that level of transmission. If you're in moderate, then we ask that you test the whole population at least weekly. Now, there may be a situation where you get so many students that opt out. Your health department, in reviewing it, may say, testing only 10% isn't enough. So that's part of your health department's involvement in this. Next slide. So this looks at how CDC measures on the left, and how our IDPH, if you look on the IDPH website, and hopefully you're using that to monitor where you are transmission-wise in your community, just to compare and contrast. They're really apples to orange. The bottom line here for you today is that we are using CDC's definition of low, moderate, substantial, and high in terms of where we ask you to test. These are really geared toward the test positivity, new cases per 100,000, case rates per 100,000, and then cases in youth. So we actually probably need to adjust ours to be a little more toward understanding low ends and considering vaccinations, which is what you'll start seeing in our new guidance, a real heavy consideration for vaccine levels and how mitigations will follow for that. And I think that may be it for me. Next slide. Yep. And I'll turn it over to Beth Heller from Shield, Illinois. Over.
Thank you so much, Judy. Hi, everyone. My name is Beth Heller, and I am the Senior Director of External Relations for Shield, Illinois. I've been working with Shield since we expanded outside of the university setting to help get kids back in school safely by adding this additional mitigation layer. So the University of Illinois created this program called Shield Illinois as a nonprofit unit within the university to really control the spread of COVID. And we developed a screening testing program, which is a PCR saliva-based test to roll out in school districts throughout the state. Next slide, please. So our test takes a proactive approach. We are looking to identify asymptomatic carriers, which is what the screening program does. And as Judy said, pull them out of the school environment. Next slide. We have fast results. Our results come within 12 to 24 hours of samples reaching our labs, which we have 6 of located all throughout the state. We report daily to IDPH and the school district through a HIPAA compliant health records portal. Really, our goal is to get you the results before the individual comes back to school the next day. And we're averaging under 12 hours from collection to delivery of the results right now. As Charles mentioned earlier, our test is free for Tier 1 and Tier 2 schools, and it's $10 per test for Tiers 3 and 4 schools. The university has already subsidized the price, and the state has come in and helped with even more subsidization. We also are working with private schools as well, so I'm happy to speak offline with any private schools about testing pricing as well. Our accuracy is very high. Our sensitivity is close to 97%, and specificity is 99%, which means we have really very few, if any, false positives and very few false negatives. It's a very highly accurate test. And then all of our labs are CLIA certified, which means that everything is handled under federal guidelines, and Shield will provide both the CLIA waiver and the doctor's order. So we will help release that burden from you just as a turnkey solution. And then the test is very easy to collect. It is saliva. So people are drooling in a tube. Nothing has to be inserted into their nasal cavity. And also we'll provide a third-party collection team, again, to remove any burden that we can. Authorization earlier this year. If you get a result from us, you don't need a confirmatory test. Our result is we just need one test, which is our test. Next slide, please. So this is just a little overview of the funding that is provided. So IDPH is recommending, as you've heard, weekly testing for all unvaccinated staff and students. They will provide up to twice a week testing. We also will provide a collections partner, as I mentioned, and this includes all public pre-K through 12 schools, so elementary, middle, and high schools through the rest of this year. Also, if your school district is looking to do community testing, for parents, for first responders, other people in your community, the state will also fund that as well. As you can see, 75% of schools are in the tier 1 and tier 2, so the majority of the schools are considered for free testing. And then that $10, I can show you how you can kind of balance out to make it free in one of the next slides. But many school districts are using their ESSER funds to help pay for testing. Next slide, please, John. And if you're curious about what your tier status is, you can visit Illinois Report Card, enter in your district, and then click on evidence-based funding, and that will pop up and show you what tier you are. These are some of the schools, Springfield and many school districts. And, you know, we come in, we find some asymptomatic positives, and you'll hear from a couple of superintendents that are using our test. We really drop the positivity rate down because we're catching the virus before they're able to spread it. So we're looking to catch patient 0 and really stop the chain of infection. Next slide. And this is a video that will show you how testing works. In this case, this is Dr. Suchinsky's district, 93 in Hillside, and he's using his own team. You'll see him in the video and his nursing team to do the collection. So I will explain that a little later. But John, if you could.
To test for COVID-19 without losing much instructional time. First, let's see how one school partner uses a common area, like a gym, for students to provide saliva samples. The teacher hands the student an ID badge with a personal QR code identifier. Once the student reaches the collection area, she sanitizes her hands and receives her test tube and funnel. She proceeds to a designated area, removes her mask, and begins depositing saliva in the tube using the funnel. She taps the side of the tube lightly to settle any bubbles and raises her hand once her saliva reaches the fill line. Once a staff member recognizes her, the student walks to the staff member to verify her saliva sample. Then she discards her funnel in a medical waste bin, screws on the test tube cap, and proceeds to the checkout station. At the checkout station, her QR code is scanned, followed by the label on her test tube in order to associate the test tube with her. She places her test tube in a collection rack, then sanitizes her hands once again, and leaves the collection area to return to her classroom. The student is the only person at the collection site who ever touches the test tube to prevent contamination. Including time spent traveling from her classroom to the collection area and back, this student needed less than 5 minutes to provide a sample. Now let's look at a collection model where school personnel bring testing supplies to each classroom.
John, you can stop.
On the drool.
Thank you so much. So at the end of that video, it showed that she was back in her seat at 3 minutes and and 14 seconds or something like that. All of our school districts report back to us that it's under 10 minutes of time to get from the classroom drooling and back. So it's a pretty quick process. Next slide, please.
Beth, I'm in 1 second. We're trapped in the video. 1 moment.
Okay. I can explain too. So one of our, so what Shield provides is we provide all of the testing. We provide all of the equipment. I'll just explain this quickly. This is what our reporting dashboard looks like. So we use a system called Point and Click, and Point and Click will deliver all the results to you via this online portal. And so on this portal, you'll be able to see the name of the individual, if they're positive or negative. Also, you can look at a screenshot of however many given days and see how many positive cases you have, a percentage, et cetera. And it will even show you your positives mapped by zip code. So it's very easy. And I know our partners really have no problem and like using our dashboard. Next page, please. So this is what I was getting into before that slide. IDPH and Shield really are trying to provide most of the heavy lifting to create and provide a turnkey solution for you. We will provide the technology platform, all the supplies, and the third-party collections team. The school district will provide the space, the operations plan, consent from participants, and then communications and contact tracing. So there's 3 options available to partner with Shield on testing. Number 1 is weekly testing, where we provide a third-party collections team. The third-party collections team, I will explain a little bit more on what they're providing. Option 2 is weekly testing, where the district does their own collection. And 3 is emergency outbreak testing. Next slide, please. So with option 1, that is where a school district selects this option when they're looking really just to do weekly testing frequently on unvaccinated individuals. The third-party collection team will come in and they will operationalize everything for you. They will do all the collecting like you saw in the video. They will transport everything to the lab, and they will call all the positive results for you. There's a minimum sort of requirement for them to come out, which is about 100 samples per the time they come out. And if you feel that you can't get that many, or you're looking to do, you think your consent will be lower, then option 2 is the right path for you. And option 2 is where the district collects themselves. And we will pay you $10 per test to handle your own collection. And this is how you can balance it out if you're a tier 3 or tier 4. We charge $10 for the subsidized test, and $10 we pay you, so it balances out. And this is just it's a pretty easy way. Most of our school districts were doing this before there was this funding. A lot of our businesses are doing this option. And Kevin, Dr. Suchinsky, as you saw in that video, that's how he's working it. We would help you with all the training and make everything pretty turnkey. Next slide, John. So outbreak testing is the third option. And basically what IDPH is asking you for is to get everyone consented. And that way, if you have an outbreak, Shield can come in. We have a mobile unit that can come straight to your school district and work with you on doing testing and getting you set up for options 1 or 2. I'll let Charles maybe just highlight a couple thoughts from here on this slide.
Thanks, Beth. So really, I think this is part of the real value add that Shield also brings, and that we're able to leverage under this intergovernmental agreement, is that they can be ready, at the ready, and respond if there is an outbreak. They can go right to you. But the other piece is that also in terms of having a program available, I like what Beth said about the flexibility in terms of, you can either collect the sample yourself and send to Shield, and then they work all of it out in the lab, which you don't see. This is conducted in a high throughput laboratory. There's teams of technologists back there actually processing the test. But alternatively, again, we heard that schools had some administrative challenges, so they can send a team out on a regular basis to collect. So it can be both ways. And so, Shield is ready and can be deployed. We, again, are recommending a cadence of once a week testing for those who are unvaccinated. And then beyond that, you'll hear about Binex now, which could be a great resource for those, particularly if they're showing up symptomatic, as Judy mentioned, being able to rule out COVID quickly or identify a positive quickly. And you'll hear some more on that. I'll give it back to you, John, or Beth. Thanks.
Great. Thank you so much. I'm going to just skip this video for now, John. I think just for time, I just want to make sure we can get through. I know there's lots of questions in the chat. So next slide, if you don't mind, John. I believe this is where we're heading. So really the goal here is if this is something that interests you, I'm happy to answer some of the questions in the chat. I want to allow for time to be focused here today on the quarantine questions, on the guidelines. I'm happy to meet with you outside of this meeting. I do weekly or twice per week meetings where I share all the details about Shield that I didn't have time to share today. And then usually we do one-on-one meetings where I can answer questions and help you figure this out for your own district on which is the right path for you. So my email, I believe, is on the next slide. I will put it in the chat. Please reach out to me. There's also this questionnaire that it's a quick interest form. If you are interested in testing, if you could please fill it out, it comes directly to me and we can schedule a time to meet. So thank you so much. I'm going to turn it back over. I believe the next on the docket are some of the superintendents. John? So if you want to introduce them, that'd be great.
We're going to hear from Zach on antigen testing for just a few minutes, and then we'll go to our superintendent. So Zach, please.
Perfect. Thank you all so much today for your continued attention and also for your attendance. We really appreciate this opportunity to share which testing opportunities are available to you, mostly free of charge today. My name is Zach Bacon, and I'm a clinical lab technologist here at IDPH. And since October of last year, I've been leading the deployment of the Binex Now antigen test from Abbott Labs. And this test is available to you free of charge. And I wanted to take a few moments today to just go over the steps involved with getting this testing program getting started at your school or facility. So the first step that you'll need to do is to obtain a clinical laboratory improvement amendments waiver. So to do this, you'll need to complete the CMS 116 form from the CLIA website. After you fill that out, you'll then need to submit it to the appropriate state agency here in Illinois, and you will receive a specific CLIA number that is specific to your facility. That will then be used in order to move on to the second step in this process. So you'll then need to register for results reporting. This is as easy as filling out a red cap survey and submitting it back to IDPH with your CLIA number. And then basically somebody will get back to you and give you a unique link where you can report all of your test results every day for the Binex antigen test. Then you'll need to obtain a standing order from a physician. We do have templates available to share. If you do need a template, you can reach out to the email address listed here in number 4, and somebody will be able to share that document with you. And then finally, after you've obtained all those 3 steps, your last step is just going to be to request that first shipment. So again, you'll reach out to that same email address that's listed here in number 4, and you'll need to provide the facility name. You'll get primary contact information, including your name, your phone number, and your email address. And then you'll be able to request your shipments in quantities of 640. Now, I did want to note here that there has been some extensions to the expiration dates for the Binex Now test. More testing is currently underway at Abbott to actually identify when the true expiration date is for these tests. However, the original extension was 6 months, but now many of them have been extended to 12. So prior to disposing of your tests, if you believe they're expired, make sure you do reach out to us, again, using this email address in number 4, and we can share a document with you so that you can check and see if your tests are indeed expired or to figure out what that true expiration date looks like. But that's pretty much all that I had to share with you all today. I just wanted to run through what the steps look like. If you have any questions, please feel free to reach out to me and I'm happy to answer them for you, or I can at least get you in touch with the right person. I'm going to go ahead and turn it back over to John, and I think that he's going to introduce our superintendents today. Thank you.
That's right. Thanks, Zach. So we are going to have about 10 minutes to hear from 4 superintendents who have implemented some level of a testing program. And so I'm going to start by turning it over to Assistant Superintendent Daniel Johnson to share about his experience with the SHIELD test. And I'm going to pull out of sharing for just a moment so we can all see each other a little better.
Thanks, John. I don't know if seeing me any better is a good idea or not, but good morning, everybody. And I just want to start by saying thanks to the IDPH and SHIELD and all the partners associated with this for all the hard work to get a testing option like this up and running. I'm from Proviso Township High Schools, which is in Maywood, Forest Park, Melrose Park area. And we have been throughout the entire pandemic, like all of you, I'm sure, interested in whatever we can do to keep all of our students and staff and school community safe. And when we learned about a testing option from IDPH that was sanctioned and supported by them, we were very, very interested in it and contacted Beth and basically started working with it. We're doing option 1, which is using the third-party collection company for ours. And I think earlier in the presentation, somebody referred to it as turnkey, and it really was. For us, everybody was very helpful from SHIELD and from the third-party collection company in getting the process up and running in our schools. We started out by doing testing 1 day per week in each of our schools, and then we were remote, so we didn't have a lot of students in the building, but we did have, for our athletic programs, a need to try to make sure that we got those students, some of whom were remote and some of whom were in-person participants, tested. Our third-party collection team worked with us. They were very flexible, and we were able to test all of our athletic participants because we were making that mandatory for them. We want to be able to use it for screening, as you've heard, to look for those asymptomatic positive cases that are out there and prevent an outbreak and others from possibly contracting it in our schools. And so it's just been wonderful. The saliva testing, as someone who's taken the nasal swab test a couple times, the saliva testing is the way to go, if you can do that. And very easy. Our students and our staff have all participated in it. And the last thing I'll just say is the reporting mechanism is very, very smooth, and we got our results back by early the next morning. So that was working very well. So just really appreciate everybody's efforts in getting this up and running, and look forward to continue to work with them as we enter into the next school year.
Thanks for sharing that. And I also want to note all of our panelists, including our superintendents, will be available for questions during the Q&A. So I think if you have a superintendent question, let us know. Dr. Kevin Suchinski, please go ahead.
Thanks. Just for the record, I was in WebEx jail, so I felt like I was a mime for a while, John. So I feel like I could see everyone. Thank you so much. Kevin Chinsky from District 93. We're located in the Proviso area, take part of Hillside, Berkeley, unincorporated Cook County, and Hillside. I think we were the second district that started testing with SHIELD Illinois. And for us, this SHIELD for testing was really important. In the Proviso area, we had a higher positivity and mortality rate than based upon the average. And for us, it was really crucial for us taking a look at that. We were doing 15 hours of in-person instruction. And in terms of that testing, we found that as we finished up our testing, we're at a 0.5 positivity rate. I just want to reiterate that. For our testing, 0.5. What we found here is we are a self-collection. And for us, the flexibility of doing self-collection was amazing. We could determine if we had a situation that we had a day off, or we had an institute day, we can switch our actual testing sites. And that was really crucial for us. In essence, for us, we were also on a beta testing with SHIELD Illinois, where then we'd also get a text message or an email indicating that we had positive results. But I want to leave you with this. This is the crucial part about this. In order, screening testing is about catching asymptomatic students, staff, and community members. We test our community, our parents, our first responders. They come in, we do that in the parking lot. What we found is that we were catching much more asymptomatic students, staff, and community members. In this case in point, we had a person who tested in our program, was asymptomatic, positive result, went back and got another test, was a negative,
8 days into it, developed some really severe symptoms, had to be hospitalized, and still is facing what they call some of that COVID fog brain and dealing with some of those long-term effects. So whatever you do, I encourage you to test. Whatever you're going to do is test. And the screening is so important. And for us, it allows us to keep open our doors. We went then from 15 hours to 20 hours of in-person instruction. I will tell you that once our teachers knew that we were doing the testing, they would know, like, all right, who's testing? Their anxiety level would lessen. They would feel so much better. Our teachers, even though we have about 90% who are vaccinated, all go through that testing station. And I'll leave you with this one last anecdote. Being a small district, early childhood to 8th grade, we do 145 tests in 30 minutes. We are done. Kids do it quick. So don't get into the point of early childhood kids can't do it, kindergartners can't do it. They get it done so quick that we have a line and we're trying to catch up to scan them to literally get the results in. So thank you very much to IDPH and Shield, Illinois, and everyone else on the panelists. I do appreciate the opportunity to talk.
Thanks, Dr. Sachinsky. We'll go to Dr. Patterson. Dr. Patterson, I believe you shared with me yesterday that you're planning on implementing both Shield and Binex now in the fall. Could you share a little bit more about that with the group?
Yes, hi. Hello, everyone. Good morning. Thank you to IDPH, Charles. I am in Markham, Illinois, Prairie Hills, District 144. So we service Markham, Hazel Crest, we're in Southern Cook, Oak Forest, and portions of Country Club Hills. We've been using the Binex testing since October, and we've used it throughout the entire year. We have been in session in person with about 30% of our population since August 26th of 2020. And so it's gone really well for us. Been very pleased with Binex. We have been, the only issue that we encountered, a couple of issues, but one of the ones, or one of the reasons why we are going to use both Binex and Shield is that we encountered about 5 cases of false negatives. And in each case, we had to send staff for a PCR test. And so it was just an additional layer of complications during the school year. And so since we're preparing for next year, we do intend to use both Binex and continue with the Shield. We're going to actually utilize the Shield program weekly. Right now, currently, we're testing district office tests every week. So all of our staff within our district office is testing weekly. Starting next year, we intend to do that for all staff, and we're looking at the options for students. So yeah, we intend to do both. If anyone needs some assistance with the CLIA waiver or any of that information, it was not cumbersome at all. It was very quickly. I have assisted several districts with this process. And so if you need some help, please feel free to reach out. The only other advice I would give is initially there was some misinformation shared with staff or amongst staff related to their consent waivers and the unions. So I would always advise having some direct conversation with the unions and with staff for those consent waivers. Much easier with our parents and student population than it was with staff.
Thanks, Dr. Patterson. And then,
my pleasure.
Yeah, thank you. And well, so finally, Dr. Victor Simon is an advocate for Binex now, has had run a successful program with antigen testing in his district. So Dr. Simon, how did you make this happen? How did you implement Binex now this past school year?
Yeah, sure. I think first of all, thanks for having me on. And I'll tell you, just like Dr. Patterson said, the CLIA waiver, the process, these kinds of obstacles that are out there, not cumbersome. This is something that
you're going to be finding positives and looking for them, which I almost prefer that over quarantine. If I had my way, I'd say let's screen and less focus on quarantine, which you'll hopefully see in the updated guidance.
Thank you. So this is a kind of unique question, but for any district that may cover multiple counties or be in multiple counties, how should they check their kind of case rate for their county?
Yeah, sorry about that. That has to be so confusing because our health departments all have different spins on things, and they are the public health authority in your community. So some are a little more conservative than others when it comes to, in particular, what they'll allow for quarantine. We've certainly seen differences there. But yeah, you should use the county where the school building is located for your metrics. And they're going to correlate pretty closely. And if you're low and everybody around you is moderate, I would stick with moderate because your students don't know boundary, and work with your local health departments. They'll have a better handle on the transmission levels in your community and what they're seeing to recommend the best approach for you.
Gotcha. And one more for Judy before I move to another panelist. What kind of percentage of cases are asymptomatic that we see just in general when we're testing folks? How many of those might be asymptomatic?
I put a link to that question in the chat to the CDC guidance where it estimates up to 50% can be asymptomatic in the adolescent population. I think that's high, but what I do think happens is children do have pretty mild symptoms. And so they're always like my college students are always tired. They always have a headache from stress. And so I think there may be underlying symptoms that are pretty mild that don't get recognized due to just being a student and being tired all the time and not sleeping enough. But many students will have it and not recognize it to the point where they're going to stay home. So they're going to be walking around your schools. And then in addition to that, you have the pre-symptomatic period where it's the day or two before they become symptomatic, where viral load is going to be high and infectivity is going to be high. So these are your highest risk students. If they're sick, they're home, you know them, they're out of your school. But you've got these little vectors walking around, and maybe big vectors walking around, who could be highly infectious that you can't see visibly because they're not exhibiting symptoms, either due to being asymptomatic or pre-symptomatic. Over.
Thank you. We have a question for Beth. Do you expect the turnaround time for results to increase when volume increases when school is in session? Based off our current level of demand, is that something we think we're looking at for the fall right now, Beth?
No, we built this program as a mass testing option with many labs throughout the state and the ability to expand. So we are ready to handle everyone.
Cool. And this one's kind of for Judy and Charles. Someone said, just to clarify, is the vision for next school year, everyone who can be in person is in person with masks in the school setting and testing set up with extra mitigation, isolation, ventilation, hand hygiene? Does that sound like the vision for next year, Charles and Judy?
No, I'm the worst bureaucrat and somebody that can never keep a secret. So I'm probably the wrong person to ask this question. But we are definitely working on new guidance that with low case rates and good vaccination coverage, we will be pulling back as much as we can safely do. ISB wants everybody in person. And we know that for many school districts, being in person and maintaining social distance just isn't possible. And so we are doing everything we can do and looking at the science to ease up wherever we can. Lessening up on quarantine is definitely in the draft. Outdoors, really focusing that being safe and not even considering close contacts in the outdoors are things we're thinking about. With vaccination, allowing unmasking with vaccination levels at a certain percentage, allowing unmasking, lessening social distance. So all of that is being considered. I think it's just such a tough time for us because, there's still some unknowns. We're nervous about case rates, whether they'll stay low as we ease up. And so, but I think similar to what CDC recently did with school higher ed guidance, looking at if you're fully vaccinated versus not, things can look different. So as much as you can promote and facilitate vaccination of your staff and your student population and your community, that's going to be key to us getting back to normal as much as possible. Over.
And I'll take the testing aspect of that because Judy laid out the vision for all those elements so well. But the key message that I just continually want to kind of drive home is that it's about infrastructure. It's about having a testing infrastructure in place. You have your program in place. You strongly encourage your students and staff who are unvaccinated to opt in. So it's there, it's readily available, and you can then dial it up or dial it back as needed. You calibrate according to the needs of the community and the student population and positivity at that time. So you want to make sure that it's available, that you've given individuals the option and freedom to at least make a choice, but you should also encourage it, strongly encourage it, because you put it in place and then you're ready. And that's the key piece. So I'll pass it to you.
And just to reiterate, testing will continue to be a strong component, and testing in accordance to the CDC recommendations, those are not going to change. And then ramping up during outbreaks, because to stay at low rates, it's going to require us to quickly contain and mitigate when we do see surges. So yes, absolutely, testing will continue to be an important component in school programs going forward.
Thanks. I want to ask a question to our superintendents. There was a question about how you, for those of you that did self-collection, whether that's maybe one person can answer from the Shield perspective, one person can answer from the Binex perspective. Someone wants to know, how many staff did you need, per building to get this done? And, your nurses, your health aides. I mean, how many staff are we talking about for every day of testing that you're doing? So maybe Dr. Suchinsky and Dr. Simon can quickly share.
Yeah. So for our self-collection, we run 2 different lanes, but in essence, that requires us to only have 3 staff members to only do about 140 people in about 30 to 45 minutes. Once kids get as used to training to do it, we use a large gymnasium. So the bigger space you have, the better off you are. We actually have tape boxes on things. When we come into school, we give our kids about a half an hour, and then they just start coming right down to the gym to be tested. And for us, you probably need 4 to be able to do that, but it's so quick and easy because you're not touching samples. All you're doing is giving them their sample kit. They take the saliva, you scan it, and they put it in the specimen box, and you are done. It's pretty easy.
For Binex, we have 2 nurses. We've always had 2 nurses in our school district, 1 in each school. They're heroes as far as we're concerned. Many of the nurses this year obviously have been. They're the ones that are doing the collection through Binex. So this is seconds. These are not minutes long tests. This is seconds. It's a nostril swab. It's not this, painful situation or anything like that. So these are students as young as pre-K all the way through 8th grade that are being, that collection is happening right there in the nurse's office. They have all the PPE and training that they need. That was done last summer. And that's who does it. So there's some overtime for our nurses in the sense of community after school type windows on special days that we might run more testing type clinics. And that's who does it. Others can, and others have been tested here on site or trained on site to do testing if we need them as a backup.
Thank you. And I want to clarify for everyone that that third-party collection option is included in the costs that were outlined for Shield testing. But with Shield testing, there is an opportunity, again, for the school to be paid $10 a test to do your own self-collection. So that's an opportunity to potentially fund the staff to be able to get that done. And as Beth probably shared, you can do that for Shield with really they use volunteer college students at the university. So opportunities for who you want to work with. I want to get to one more question today, which is about this question of who we're testing. Judy, why are we not testing vaccinated students?
Because the vaccine's good. And we know that a couple things, that the vaccine is very effective. It's very effective in not only preventing someone who is infectious or preventing someone from becoming sick and having severe disease after being exposed to SARS-CoV-2. It's also been shown to lower potential transmission in our long-term care facilities where we are finding some breakthrough. We are not finding secondary cases, and data are increasingly supporting that even with breakthrough, the potential for that person passing it on to someone else is very low. And another thing is we reward vaccine. Vaccine gives you power. It helps you move about with lower restrictions, but it also gives you increased security in knowing that you're not going to pass it on to someone else or you're not going to develop severe disease. And so we want to endorse that science. Over.
Thank you so much. Hey, I want to thank all of our panelists for their time this morning. I want to thank all of our attendees for joining us. I really ask, we are going to take all of your questions back. Some of them were complex and we are aware of them and still working on answers. So we'll be trying to distribute that in the coming days. But right now, I'm going to leave things open for just a second. Please type your questions into the chat, into the Q&A. We'll make a note of that, include them. And again, these slides will be distributed shortly so that everyone can take a look at it as well as the recording. So thank you all so much for joining us today. And this concludes the IDPH COVID testing, K-12 COVID testing webinar. Thank you. For our panelists, you're good to jump off. I'll be on just to collect all the questions. Really appreciate your time this morning. Excellent job.